Some Australian epidemiologists believed public health response and preparedness are still needed to tackle the pandemic, despite COVID-19 restrictions were further eased in the country.
You can see that 2022 has been by far the biggest epidemic in Australia since the pandemic began. So we've now recorded almost 6 million cases, and about 5 million of those cases have been in 2022, just not even 4 months. And 2/3 of all the deaths have been in 2022. So twice as many deaths this year as 2020 and 2021 combined. I think they've been told that Omicron is mild, and at an individual level, that's true. But when you have a lot of cases, a small percentage of a large number is still a large number. And we've been averaging about 200 deaths a week, which is a lot more than, say, people die on the roads or from suicides or from any other accident. So it is a very important health problem.
Australia used to take strict measures to cope with the COVID-19 pandemic. More than half of its population were put into lockdown last winter, and its second largest city, Melbourne, saw the world's longest lockdown with more than 260 days. However, the number of cases surged from the beginning of this year, after restrictions were lifted.
What I would say is that right now in the BA2 wave, we're still just getting over the BA2 wave. So relaxing restrictions now is a bit premature in terms of, it would be better to wait until the numbers are down even more before you relax all your protections and restrictions. Right now in Australia, basically the idea is being promoted that this will be similar to the flu, and we'll have yearly surges, and we'll have a yearly vaccination program, and we'll get to kind of living with the virus in a way that most of the time allows us to live like it was 2019. That's unlikely to be the reality. We have, waning of immunity from boosters. And we have the potential for a new variant that's more serious.
Toole said countries need good surveillance and flexibility on easing and reimposing restrictions, depending on severity of the pandemic, and easy access to tests, free of charge.
Improving vaccination is number one. So we need to help the world get vaccinated, and China has been contributing very generously to that. The second is we need to have good surveillance, better surveillance, so that we can pick a new variant, we can detect a new variant very quickly after it emerges and before it spreads across the world.